deficiency is a challenge prevalent in Africa that occurs in childhood. If not properly managed, it could negatively affect the future and destiny of the individuals affected. Dr. Simeon O Afolabi, the Chief Clinical Audiologist at BSA Center for Hearing and Speech, posits that the high rate of human hearing loss is attributed to the inexperience of parental care after childbirth. Dr. Afolabi said this during an interview with CEOAFRICA in his Lagos office based in Ikeja, that the number of individuals with a hearing loss is on the increase, adding that such individuals need medical attention before it gets out of hand.
BSA Speech Center, which we started some years ago, is dedicated to taking care of individual children and adults with hearing loss. We see in our society, even world at large, that the numbers of individuals with hearing loss is on the increase, and we have committed ourselves to helping those ones that have hearing loss, which affect their speech and which goes ahead to affect the whole of their life. So in the little we can do, we've been seeing quite a lot of patients. We've been able to do the little we can do to make life a bit better for them.
Furthermore, the audiologist states that hearing loss is a common birth defect, most especially hearing impairment in infancy, which is associated with adverse permanent defect in speech and language development, including social and emotional development in children.
Causes of hearing loss specific is varied. A lot of them can cause it, but in brief, you look at causes that could happen during delivery when the child is being born, because you have causes after birth, and look at causes during lifetime. So that's how we categorize them. You look at them. So like a child, when the child being born at birth, jaundice, you look at, so jaundice could affect hearing nerves. Issue of lack of hygiene at birth could affect hearing nerves. Measles, some children that have meningitis, it can affect their hearing loss. And when you are growing up, some people can be exposed to some kind of drugs which are toxic in nature. It could damage hearing. Our environment could contribute to hearing loss. When you expose yourself to loud sound, impactful sound that's so high, like gunshot, like blast, all this can damage hearing. And you see individual, also we could see that in families there could be hereditary kind of hearing loss. It can run in the family, they call the hereditary kind of hearing loss. There's no can do about that, it will happen. And also you have age-related hearing loss, which is common to with old age. As you grow up, hearing loss could develop. So that's age-related. Accidents, our way of life can affect our hearing and can cause damage to hearing in different or various degrees.
According to him, some of the hearing challenges faced by the individuals can be corrected at the early stages in life. However, Dr. Simeon O Afolabi charges parents to always look after their children's health status by frequently using the hospitals or medical centers for regular checkup. In a new development, the hearing specialist speaks on the importance of BSA Hearing Foundation, which he says will be an innovation to the country in training professional audiologists.
Especially during the first 3 months of pregnancy, the mother should take up the drug they are taking. Take up the drug the pregnant mother is taking, which may likely affect the child in the womb. And also during delivery, prolonged labor will affect the child. When lack of oxygen will affect the auditory nerves, so will cause hearing loss. And also even at birth is advocated when the child is born. One of the most important tests to be carried out is hearing test for a newborn child. If that is done, even the child have a hearing loss, a lot of programs are put in place to help the child out of it. But the issue is that most children, when they are born, especially in this country, no hearing, no neonatal hearing screening was done, is done. So the mother will not know that the child is carrying a hearing loss. And so when the child grows up, the child becomes 1 year, 2 years before some mothers begins to know They begin to, this child is not talking, this child is not responding. So then they begin to run about looking for what's the problem. And you see in our society, we want to deny the truth. Even when the first time you see them, you tell them the problem. They live in denial of that truth. So they'll spend another 1 or 2, 3 years going about looking for what they would like to hear. And you see, by the time is going, the child's condition becomes difficult to help. Because there is an age for any child, we call age of readiness to speak. So when the child is growing out of that age, developing speech becomes a problem. When you put a hearing aid, it becomes difficult for a child to be able to, for the brain to recognize the sound. And the content we talk about, when you do it, even at a late age, 5, 6 years, it becomes difficult to help the child. So early intervention is crucial when you talk of children, which most mothers do not realize. They spend a lot of time, wasting a lot of time looking for truth they want to hear. And they don't look for the truth. So for a pregnant mother, it's important that we advocate that it's important. When the child is born, do a hearing screening, neonatal hearing screening for a newborn child. By that, you will save the child a lot of problem. The child will develop speech normally, we hear the environment, we learn normally, and we live a full life. If all these things are done. So it's fun. And that's why, with all these problems that society faces, and that face, family face, that's why in this center we are now rolling a foundation to help persons with hearing loss. And the foundation is targeted at individuals with hearing loss who cannot affect these devices, community service, whereby we go to a community, we run a hearing screening for them, we have the indigent in the community to connect them to word of sight. And I say also, because we look at our community, our nation, this audio education is not what's supposed to be. We want to help in that area. We want to help to increase the number of professionals in the area of audiology in this country. So that's one of the areas the foundation is looking at, how to channel resources to help. Maybe train people, maybe help the education program to train more audiologists in this country. We are looking at that. That's something on the pipeline. We look of way to do that. But the immediate need is to help individuals we see every day, persons we see every day, children we see every day, who can't hear, who can't be helped, whose parents are incapable to help them. We want to connect them back to God, move them to hear. So the foundation is now targeted at to raise funds, resources, help wherever possible to help those with hearing loss, children, adults, as a possible.
It is essential that audiologists are well trained in handling the sensitivity of hearing and speech challenges for proper management of those affected by it. That is, BSA Hearing and Speech Center is advocating for training of those that would like to specialize in these areas.